Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Mary Leung. Thank you for joining us today, Mary.
Thank you for having me, Kim.
I'm really happy to. So I usually start by saying how we met, and I'm not exactly sure when we connected on LinkedIn, though we followed each other's posts for a while. And I recently reached out to you because of one of your posts, as I know you help physicians find ways to reduce time spent charting. And I'm looking for ways to support my own local physicians. And I believe this is a significant issue for so many doctors pretty much everywhere. And we also talked about our Long Island connection with you being there. And I made a recent trip to hear Dr. Bob Kornfeld's band. They played the opening music to my podcast. So our hope is that we can both hear them together next time and have a chance to meet in person.
Yeah, that would be great. And one of my offices is actually not far away from where you were a couple weeks ago.
Oh, okay. Well, that's exciting. Well, we'll make it happen sometime in the spring. Bob's on it. He's going to plan a gig. I told him he's got another groupie.
Sounds good.
So by way of introducing you a bit more formally, Dr. Mary Leung is a full-time physician specializing in medical oncology and hematology. And I have to say, I love that. And I love my own oncology hematologist.
Mhm.
And your passion is to help patients to the best of your ability. And like many physicians, Mary experienced burnout, stress, and overwhelm, and you were just going through the motions every day and not really living. And life coaching transformed your life, and you reduced your charting time by 2 hours each day, and you feel better, alive, and get to spend quality time with your family. So I love all of that.
Thank you. Thank you.
And so today we'll be talking about your message to physicians from your website, where you say, I'm here to guide you to feel better, find efficiency with charting and administration, regain control and manage time to live life really in the present, really to its fullest. And I think that's terrific. So, what would you most like our audience to know about you as we begin our conversation?
Yeah, so and thank you for the very nice introduction. And I just want to share that I am an ordinary person.
Mhm.
And I think like many other physicians, I have experienced burnout, and it's beyond burnout that I didn't even realize that what I was going through. I was feeling drained. I was really numb, and as you mentioned, just going through the motions. Every day I got up, I just wanted to end the day already. I dreaded, I didn't want to get up. And just thinking about the full day of patients, and then had to chart for, a few hours afterwards, and sometimes even, bring the chart home, nights and the weekends. That was a terrible feeling because I felt like I did not have a chance to do a good job myself, to take care of my patients, my family. And it was an awful feeling because we physicians had gone through a lot of training,
Mhm.
and to get to this point, to be an attending, that you would think that you know I'm supposed to be in charge. I'm supposed to be in
Mhm.
control.
Mhm.
And here I am, I am not in control. I have this full schedule of patients. I can't even control my own time
Mhm.
to go home to my family. So that was really terrible. And so what happened is that, during the pandemic is when I really had the taste of going home on time, because I was seeing a third, of my patient load.
Right.
Yeah, and so, as hematologists, oncologists, we try not to see a lot of patients during that time, just to minimize exposure for everybody.
Mhm.
And we limited to seeing patients who absolutely needed chemotherapy,
Mm.
or other systemic treatment. So, by going home on time because I was seeing less patients, I felt wonderful. I felt
Mhm.
like I was living again. I actually
Mhm.
had time to think about what to do, outside of work.
Right.
And I even started baking, just like everyone else.
Okay, yeah. The bread, homemade bread, right?
Yes, the bread and cake, macaroons, you
Yeah,
name it, I tried it all.
yeah.
Anyway, so then at that time, I was also introduced to something called life coaching. No clue what it was. I thought
Mhm,
coaching was just for sports and, other things to learn. And it turned out to be really one of the most important things in my life that I have learned. And it makes sense to me that, we what we think about the situation really affects how we feel. And we
mhm,
human beings really act on our emotions.
mhm.
And of course, how we do things affect our results. I'm like, wow, no one taught me these things.
Right.
And so then I thought, well, I was really miserable, just starting the day with thinking that, oh, it's going to be an awful day.
Mm.
And of course, when I think about it right now, it's like, of course, I had an awful day because I already started off thinking that I would have an awful day. I worked with my coach at that time to really see what I could do to be more efficient, to cut down on time.
Mhm,
And I think I just want to share with everyone that it is doable. I'm
mhm,
still, just fast forward right now that I'm seeing the same load of patients as I was before this pandemic. I'm
mhm,
seeing, anywhere from 20 to 27 patients a day
mhm,
with a mix of benign hematology and oncology, and I'm going home by 5 right now,
mhm.
and
Okay.
with all my work done.
Wait,
Um,
okay.
yeah, so the important thing that I want to share with you is how you start your day. It's,
Mhm,
and how you start your day, it actually starts with the night before. So it's very important to get a good night's sleep,
mhm,
get a good quality of sleep. When you're stressed, when you're anxious, when you're thinking about things, then you don't get a good night's sleep. So
mhm,
just make it a point that, okay, when I hit the pillow, that's it. I'm going to just deal with things in the morning.
mhm,
And when I wake up in the morning, think of, just be intentional about what you think.
mhm,
I'm usually, before I get out of bed, I'm just
mhm,
grateful. I'm just grateful
mhm,
to be alive, to be waking up without snoozing the alarm. Just
mhm,
little things can be really, give you the little dopamine enough to
mhm,
get you going, to get you more upbeat, and also think about why you want to go home on time, why you
mhm,
want to be efficient. For
mhm,
me, my goal is really to go home on time, to spend it with my family, to spend a
mhm,
quality time. So remind yourself throughout the day what your purpose is, why you want to do what you're doing. Of
mhm,
course, as physicians, you want to take great care of your patients, and
mhm,
you got to take care of yourself first.
mhm,
So, the good night's sleep, the eat
mhm.
right, the exercise, those are the three pillars of basic
Right,
health.
right,
So we
right.
gotta take care of ourselves, because if we don't take care of ourselves, we can't really take great care of other people.
Mhm,
So I think, those are things that I actually didn't realize were so important. Of course, I always put myself at the bottom of the list.
right.
And I think a lot of physicians do that too. And
Mhm,
thinking that, oh, I'm not thinking about myself. I have to think of other people first. And almost
mhm,
thinking that thinking about ourselves is such a selfish thing. And I
mhm.
just realized that, yes, self care is not selfish.
Right,
So I think, because it's actually selfish not to take care of ourselves, because then we're not at our optimal shape and form to take care of other people.
right, right. Well, you're just saying everything that needs to be said, and I'm hearing things like that over and over and over again. And a couple things you said remind me when I interviewed Dr. Tamara Beckford. She's an ER physician in Texas,
And
and
my
she
friend.
Oh, good. Oh, okay, great. And she also talks about even in the morning before she gets up, filling her cup or first thing with, positive intentions and things like that. So I like the way, because some people might think, yeah, 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 or this stuff is hokey, but it's not really, right? It really just changes your brain, it changes your attitude.
Exactly, because, then when I start the day that way, then my energy, my fuel, my emotion is, hopeful, it's
Mhm.
more focused, and I get to, really rely on those as, um, to go through my day, as
Right.
opposed to the dread, the frustration, the
Mhm.
anger.
Right.
I mean,
Right.
those are probably energy that you can use temporarily, but they're also draining energies.
Yeah,
And at
yeah.
the end of the day, you'll be so tired and annoyed, and and I mean, I experienced all of the above,
Mhm. Right.
basically the unpleasant ones more, in before I got introduced to coaching, and now it's
Mhm.
definitely because I've practiced, so many days of
Mhm.
just be intentional about things. It's kind of have become automatic, it has
Mhm.
become my habit.
Right. So, seeing over 20 patients a day, so now do you do just about all your charting in the room with the patient? Is that how
Um,
you're getting it done?
so it is a mix. And I usually, what I do is, before the day starts, I already know what patients I'm seeing. I review the schedule, and know that, oh, who needs to schedule for chemo, who needs injection, who needs like special things,
Mhm.
and then when before I actually start seeing the first patient, because I have a medical assistant and a nurse working with me that day. They rotate, so I don't work with the same people, every day.
Right.
Then we just have a quick little huddle,
Okay.
and I tell them, okay, what needs to be done, and then I also tell them that today is going to be a good day, no matter
Okay.
what happens. So that starts my clinic day. And in terms of the charting, is for the follow-up patients, because since most of us are using the electronic health
Right.
system, right,
Right.
records, and so I just kind of look at the chart, and kind of copy forward my last note, and just
Mhm.
change whatever needs to be changed,
Mhm.
because a lot of things like your history, the oncology history, those things don't change,
Right, right.
and
So
and
sorry, when do you do that for each patient? Like before the day starts, you do all 20, or just before you see, or when the patient is in the room? When do you actually do that?
Actually, before, it's just each patient, I do it separately before I go into the room, and
Okay.
or usually sometimes is if I have a little bit more time before that, when I see the patient is checked in, I start the
Mhm.
note.
Okay.
So that is really helpful. And then when I go into the room, I greet them, and then my room is set up in a way that I'm facing the computer, but I'm also facing the patient.
Mhm.
So then I'm thankful for my typing skills that I can
Mhm.
type and talk to them at the same time and actually look at them.
Mhm.
So I'm not really looking at the keyboard when I'm typing. So that's really helpful. So usually by the time that they finish telling me about what's going on, I'm almost done with, the history of present illness, that part
Mhm.
that, oh, what's
Mhm.
going on, what's new, those things. So that is really helpful. And I think that for other physicians who can do that, because, it's really seconds here and seconds there. So if we can
Mhm.
save, the seconds, it becomes minutes and hours.
Yeah, yeah, absolutely. Yeah. So, because I know it is important to you to have that connection, because you've mentioned it, I've heard, with your patients. So you feel like doing that there with them, you still feel like you're really listening, um, and you're building that relationship.
Yeah. So bef I think in the past, I would think that, "Oh, I have to, really pay attention and look at them the whole time and not type," because typing was kind of a distraction, and I would just type, at outside of the room, and then I just re-examined my thinking, and I thought, "Well, you know what? This is all about them." And when I'm typing what they're saying, and actually, in a sense, it's better, because then I really don't have to worry about forgetting something,
Mhm.
and I just do it real time. And
Mhm.
they know that it's all about them. And I just emphasize, hey, because they ask, okay, I'll wait till you're done to ask you. I'm like, no, no, it's okay. It's
Mhm.
all about you. So just tell me what's going on. So there, I think by now most of the patients are used to it, and of course, other doctors they pretty much do very similar things. So I think everyone is used to having the computer and people
Mhm.
typing, or sometimes, some practices they use a scribe, or like an
Mhm.
in-person
Right.
scribe that they may have another person do it too.
Right, right, right. So that transition has been really critical for you then, because instead if you're getting the notes, so you're saying your notes are just about done when the patient each patient leaves?
Um, So I would just say that sometimes I actually have the notes done in the room, when we both leave the room.
Mhm.
And sometimes I just have to, because if the plan is a little bit more complicated, I would just, after I send the patient out, I would just
Mhm.
finish the the rest of the note in my office.
Mhm.
So my office is set just a few steps from the two exam rooms that I alternating
Yep. Okay.
in, and I find that also very um, helpful is to really see the patient and do their charts,
Mhm.
right afterwards, and then you will have the focus and the capacity to really pay 100% attention to the next patient and not think
Mhm.
about, oh, I
Mhm.
forgot to do this for that other patient, or oh, what was the exam again? Because then you get mixed up if you have multiple
Mhm.
patients on your
Yeah,
mind.
yeah, no, absolutely, yeah, and I'm asking you these detailed questions because I think sometimes it is really important for physicians to really see how that this could possibly work for them, and and specific obstacles they might face. So another question I ask, with over 20 patients a day, because you'll say like, well, I'll do this like, when I see that them checked in, or right before I see
Mhm.
them, or right after I see them. So if you have over 20 patients a day, do you have like a 5-minute buffer in between patient? Because actually, like you'd think that you're just like washing your hands and going right to the next room. So how do you fit all those patients in a day and have those few minutes in between to finish something up for one patient, start for the next patient?
Well, I'm actually very thankful that you bring this up about the break time. So I think that what I used to think that is, oh, you know what? I have so many patients, I have to plow straight through, no breaks except for when my bladder is bursting, right?
Right.
And that was used to be me. And now I realize that taking little breaks, it's
Hmm.
really it helps you to be more efficient. And
Hmm.
the little breaks can just be a minute or two, just be calm down, or just not think about anything else about work, or just look outside my window to look at the trees,
Hmm.
anything to be
Right.
keeping your mind off. So I think that for me it depends on the situation, and sometimes, so I'll just say, for the most part, my follow-up patients are usually scheduled for 15 minutes,
Hmm.
and for new patients it's about 45 minutes.
Hmm.
And of course, some oncology patients, especially if I have to tell them about a new treatment, or if they're
Mhm,
not doing well, I would choose to
mhm,
spend more time with them.
right.
And I'm also, at the same time, is I'm mindful of my time. I think a lot of our computers, we have like a little clock
Yes.
at the corner, or sometimes even in the room they have a bigger clock. So
Mhm,
just be mindful of the time. So I'm mindful, at the same time I'm not in a rush, because I
mhm,
tell myself that if I need the time to talk to the patient, to make sure that they're comfortable, they feel safe, they feel they're careful, I will take the time, and I'll just kind of quote unquote steal some time
uh-huh,
on my
sure.
other patients if they're
Mhm,
just really straightforward. Like, for example, they're just following up for eye deficiency and they're responding well to
right,
the
right,
treatment.
right.
So I think that sometimes, yes, when I see a few patients, I may not have really a true break in
Mhm,
between. At the same time, is I actually give myself a little quick few seconds break
mhm,
to
mhm,
celebrate that, oh, you know what? I have, seen 2 patients, and, like,
mhm.
20 more to go, or, so
Right,
that's
right,
actually like
right.
a little boost, actually helped me
Mhm,
refuel myself to say that,
mhm,
"Hey, you know what? I have more energy to go on." So I think that is really helpful because, I think there's no such thing as too much celebration.
Uh-huh, right, right.
And
Yeah, and I
and no
think
such
you're
thing as to be too grateful. So I think, the celebration and the gratitude, they go together. And, it really works well to go through the day, because then, when things don't go well, because I already remember that, hey, there are going to be surprises. There are always going to be things
yeah.
that I cannot control. So when they come, it's like, okay, all right, what can I do about it? And how can I utilize my team to work together to do it?
Mhm. Right, and that's an important thing too, right? Using your team whenever you can. Yeah.
Yes.
Yeah. Wow,
Yeah.
wow, that's fantastic. You've shared so many good points so far. Is there anything else that comes to mind as far as the charting, the tips and how because you basically you said you've reduced it in half, right? Your charting time in half. And do you give yourself a lunch is a lunch break built in for you of a decent
Yes.
size?
Yeah, there's a lunch break. Doesn't mean that I take the full 30 minutes.
Mm,
And it's okay with me, because sometimes I think 10 minutes for me, it's actually enough to just slow down and just, be ready to restart. And that's kind of the time that I just relax, and I don't, I try not to think too much about my patients at that time.
right,
And just eat some food and make sure that I drink my water. I always bring a bottle of water to make sure that I drink it all by the time
right,
that I'm done
right.
with work. And also just to um, really, I guess another important thing is it's to schedule, times for, checking things like your messages,
Mm-hmm.
your emails, and
Yeah, right.
because
That's a good point. So when do you do that?
so, I don't exactly have a set time. I just make sure that I just don't do it constantly. When the messages come, I don't just check them all, or one at a time. I make sure that I see a few patients first, and then I check the messages, because then they're going to be so distracting. Because,
Mhm,
there's really no, we're not multitasking, when
mhm,
we try to. It's really
mhm,
just switching from one task to another. And by you switching like this, it takes quite a few seconds to recover, to really get into the zone to
right.
do that one thing. So I would just say that in the morning, I probably check my messages maybe twice before
Mhm,
lunch. And
mhm.
then after lunch, before the staff leaves, I got to make sure that I check them so I can delegate, because
Uh-huh,
delegation
right,
is very important. Whatever
right.
you can delegate, delegate.
Mhm, absolutely. Right. Wow. So was it your coach? Because, when you think of your before time and your after time and how different things are for you now, how did that actually come about? Like, did you share with your coach that, look, charting is really something that's weighing me down, and then your coach gave you specific suggestions? Is your coach a physician as well?
Yeah.
Yeah.
Yeah, yeah. So, I would say that yes. We talked mainly in the beginning about the charting situation, because I was really miserable. I wanted to go home earlier, not like past 7, and still had charts to do. And so we worked on things. I think she didn't really give me specific ideas. I would just say that she kind of like guided me to
Mhm.
to come up with things that I could do
Mhm.
to be more efficient. And I think the only thing that she suggested was just see the patient do the chart, you know.
Oh, right. Okay.
And I think that is really helpful for everybody, because for me, I had that idea that, oh, I had to keep my patients as on time according to schedule as possible.
Mhm.
And that
Mhm.
cost me really a lot of hours, because especially at the second half of the day, I couldn't keep up. And
Mhm.
and I would just be piling on the charts. I was like, okay, I'll just write them later. And then at the end of the day, I was already tired. My brain was
Mhm.
shutting down slowly, and I was getting annoyed and frustrated, because I was like, how come I still have so many things to do? So
Mhm.
by seeing the patient doing the charts, allowing myself to have the next patient wait for just a few more minutes, that really
Mhm.
actually saved a lot of minutes.
Right, right. Yeah, that's a good point. Yeah. So tell us now, because now you coach other physicians and this is your specialty. So why don't you tell us a bit how that evolved into this being like a side venture for you and how you support physicians?
Yeah, so when I went into being coached, I never thought this would happen,
Mhm.
and because coaching, life coaching, makes so much sense to me that I decided to actually get into certification myself, and really just for the pure reason of just learning it more in depth, because
Mhm.
a lot of physicians, we like to learn things,
Right.
in depth, right?
Right.
So then after a while, well, since I, gained back all this time from charting efficiently, and I know that a lot of physicians are in the same boat as I was, so I
Mhm.
thought, well, if I could help them
Mhm.
to be where I am right now, just imagine how, how many people will be affected, their patients, their families, in a positive way. So
Right.
so that's how I started my, one-on-one, physician coaching program, to help other physicians to do the same, that what,
Mhm.
it is possible to go home on time, and and to do whatever you want afterwards. And guess what? That means that you can enjoy life outside of medicine.
Mhm.
And also, I think the patient, the doctor patient relationship is much better too, because you have more capacity mentally and physically to really,
Mhm.
you know, uh, give it all to that connection.
Mhm. And I think it might help it be more sustainable longer term, because now you might, well, there's a lot, right? There's a mass exodus of physicians, right?
Yeah.
And understandably so. But it could be more sustainable if they aren't working all day and then spending hours charting when they get home, right? Because they'd just be like,
Right.
I'm done. As soon as I feel like I can retire, I'm out of here, but there is a joy in practicing medicine that it feels like you've regained.
Yes, because right now I feel like, what, I can really chat with patients, outside
Mm,
of their diseases. I mean, we don't talk for a long time, but just enough to have that connection that we both feel. And sometimes
mhm,
we talk about, self-development books. Sometimes we
mhm,
talk about what exercise they do, just anything.
mhm,
And it's just for me, with that human connection, it's
mhm,
actually, a big part of why I get into, internal medicine, and also
mhm,
eventually into hematology and oncology.
mhm, right. And I think I feel like for the doctors, it's so important, like you're saying, to take care of yourselves and to have that time at the end of the day, and that it's okay. Like, say you are looking at the computer a little bit. Well, most doctors are, and
Mhm.
that's okay for a balance for your own life. That it doesn't have to be all about the patient at expense to yourself.
Exactly. And I guess the other technical aspect I want to share is, if typing is a challenge, there's always the dictation program. Dragon works great, and you can always just do it really quickly outside of the room, and it works well too. So sometimes, when I before I go into the room, when I may just do, like, say, if I already know the new plan that I'm about to tell the patients, I may just start dictating, hey, this is, the plan that I'm doing, because
Okay.
sometimes the plan is very detailed. So the dictation, if especially if typing it's a problem, that's very
Right. I was
helpful.
going to ask you that because not every physician took typing in high school, and that can come back to bite you now. So so you actually do a combination and you find that
Yes.
dictation is helpful.
Hmm.
Wow. Well, these have been really great tips and thank you for sharing, Mary. So I have a question that's a little off to the side, but in a few weeks I'm going to be interviewing Dr. Donna Coriel from SoMe and
Hmm.
she had written a book or compiled a book with Dr. Kimberly Green Leibowitz. It was What We Bring to the Practice of Medicine: Perspectives of Women Physicians. So her chapter itself is the twist of the patient apology. And she talks about, how this one point in how a patient apologized to her. And she said she was looking in the literature and she found that there's a plethora of articles on physicians apologizing to patients, but not so much in the other direction. And I tried to Google it myself and I found that she was right. And I was just curious. Because I'm doing a few of these interviews before I see her. And I'm curious, does it ever come to mind, like a patient apologizing to you for anything?
Um, I would say not so much, because I would say that when you talk about apologizing, I would just say that it's probably more that we are, physicians
Mhm.
apologizing to the patient that, oh, I'm sorry I'm late. But then I also learned that it's actually, it's better to say it a different way to, when you're late into the room, actually put the focus on the patient and say thank you for your patience. You know,
Okay, okay.
yeah, so I would
Uh-huh.
just say that patients usually, because especially when they can feel that you're really doing things for their own good and you
Mhm,
really have the heart to care for them the best that you
mhm,
can, then they do understand that where you're
mhm.
coming from, and I'll just say that because of that, that less likely to say lash out or
Right.
be angry, and sometimes if they do, I guess they may just apologize afterwards, but that
Okay.
hasn't really happened too much. I would just say that out of my I guess
Uh,
13 years of being an attending, maybe a few times that some family members could be mad more about the situation or the condition of the
uh-huh.
patients, rather than because of what I'm doing,
Sure,
So,
right.
and then afterwards they'll be, more calmed down after we talked a little bit, and then they
Okay.
apologize of what their behavior was like.
Right. Oh, okay, okay, well, that's good. I was just curious if you had experienced that. So not so often, but you have.
Everyone
So
probably
yeah,
has.
yeah. Okay. Well, thank you so very much. I think this has been a really wonderful discussion, and I'm really excited to share this episode with physicians. And how can they reach out to you?
Yes, so I'm on Facebook, Mary Leung, and I'm also on LinkedIn, Mary Leung MD. And of course, you're all welcome to visit my website at shiningwithgratitudemd.com, because I'm really full of gratitude. And my email address is shiningwithgratitudemd@gmail.com.
Okay, well, thank you. Well, that is really terrific. And I just wanted to thank you again for being my guest today, Mary. I think this was a terrific conversation.
Thank you so much for having me.
Okay, you're very welcome. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients, patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.